right now, I mean, literally at this very second, your brain is actively lying to you about your own biology.
It really is. It's wild.
Yeah, because, well, if I told you that a medical professional was going to drill a solid titanium post directly into your jawbone, your instinct immediately just screams,
Oh,
agony.
absolutely. Total panic.
Right. You picture this invasive construction site inside your mouth. You picture something just excruciating. But biologically speaking, that assumption is completely false.
It's entirely false. Yeah.
Because your brain is anticipating a level of pain that is structurally just impossible.
It's one of the most persistent medical illusions we have, honestly. We
Yeah.
tend to project our lived experience of a severe toothache onto a completely different part of our anatomy.
Which makes sense, I guess, from a psychological standpoint.
Right, but the result is this massive level of anxiety that frankly doesn't match the physiological reality at all.
And that is exactly why we are here today. Welcome to today's deep dive. You and I are going to confront and dismantle what I think is the ultimate dental dread.
It's definitely up there.
It keeps so many people away from the care they actually need, right? So our insights today are drawn from this really fascinating guide provided by the team at My Gentle Dentist in Arana Hills.
Yeah, it's titled Debunking the Dental Implant Pain Myth.
Exactly. And our mission for this deep dive is to look strictly at the mechanics, the actual science, to find out what really happens when metal meets bone.
Because the narrative around dental implants is just so deeply ingrained in our collective psyche. I mean, simply hearing the words titanium post makes people physically tense up.
I'm tensing up right now just saying it.
Exactly. But what's fascinating here is that modern restorative dentistry relies on this very specific biological quirk.
Yeah.
What you expect to happen is just vastly different from the actual physical reality.
I have to admit, I completely share that initial dread. Like when I read the source material for My Gentle Dentist, my immediate thought was, well, how can drilling into bone not hurt?
Right. It sounds contradictory.
It does. I mean, I've hit my shin on a coffee table, and that certainly hurts a lot.
Oh, yeah. Shin bumps are the worst.
So in my mind, getting an implant sounds exactly like mounting a heavy television bracket into a wooden wall stud.
Okay, I could see that.
You know what I mean?
Mhm.
You are driving a metal screw into a hard structural surface. My common sense just insists that has to be a physically devastating experience for your jaw.
Well, the television bracket analogy is actually a really great starting point, but we need to refine it a bit.
Okay, refine away.
When you picture driving a screw into a stud, you are focusing entirely on the mechanical friction of the act. The force of it.
Right, the drilling, the splintering wood, all that.
Exactly. But you are completely forgetting the sensory wiring of the environment. A wall stud is dead material. Your jawbone is a living matrix.
Okay, that sounds even worse, honestly.
I know, but stick with me.
Okay.
More importantly, there is a stark, almost unbelievable contrast between the sensory anatomy of a tooth and the sensory anatomy of your jawbone.
Okay, walk me through that contrast then. Why does a normal toothache feel so radically different than what we're talking about with an implant?
Well, to understand this, we really have to look at how we evolved. Think about the anatomy of a natural tooth.
Okay.
It is absolutely packed with highly sensitive nerves inside what we call the pulp. It operates almost like an exposed sensory organ.
Just waiting to feel things.
Exactly. And that high density of nerves is necessary. Your teeth need to feel subtle changes in temperature, like if your coffee is too hot.
Or ice cream is too cold.
Right, or the hardness of a piece of food. And they absolutely need to alert you immediately if there is decay breaching the enamel.
That makes sense.
That intense warning system is exactly why a cavity or a cracked tooth is just agonizingly painful.
So a tooth is basically designed to act as an alarm system. It screams at you when something is wrong.
It really does.
Yeah.
But the internal structure of the jawbone, it serves a completely different evolutionary purpose.
How so?
The bone is deep, it's internal, and it's purely structural. It does not encounter outside stimuli like hot coffee or hard seeds.
Because the gums and teeth take the hit first.
Precisely. Therefore, the internal bone tissue simply never evolved to have a dense network of nociceptors.
Nociceptors.
Yeah, nociceptors are the specific sensory receptors that send pain signals to your brain.
Wait, hold on. Are you saying the actual bone inside the jaw lacks pain receptors?
In the internal structure where the implant is actually placed, yes. The nerve density is incredibly low.
That is wild. I had no idea.
Yeah, I mean, there is a very thin outer layer of the bone called the periosteum that has some sensitivity.
Okay, so it's not totally dead to the world.
Right, but the deep bone itself, it really doesn't have that sensory network.
Ah.
So, the biological secret here, the thing that my gentle dentist team really highlights, is that the process of placing the titanium post into the bone avoids the heavy pain receptors entirely.
Wow.
The agonizing pain you were bracing for is physically impossible simply because the hardware isn't even installed in a part of the jaw capable of registering it as sharp pain.
I mean, that completely flips the script.
It really does.
We brace ourselves for the worst because, we associate the mouth with the intense localized pain of a sensitive tooth.
Exactly.
We just assume the bone holding the tooth is just as sensitive, but they are entirely different biological landscapes.
Precisely. Your brain is anticipating a pulp reaction. You're expecting that xanalizing of a cavity. But the procedure is happening in the deep bone. The sensory hardware to create that agony just isn't there.
Okay, but if the deep bone isn't capable of sending those sharp pain signals, we have to ask what the actual physical sensation is during the procedure.
Sure.
Let's break down the sensory experience step by step. I mean, if I'm sitting in that chair, what am I actually going to feel? No sugarcoating.
No sugarcoating. Let's divide it into 3 distinct stages.
Okay, stage 1.
Stage 1 is the numbing stage. Just like any routine dental work, the area is treated with local anesthesia.
Which means the standard needle pinch to get things started.
Yes. And because we are just numbing the soft gum tissue and that thin outer layer of bone we mentioned earlier,
Periosteum.
right, the periosteum. Because of that, the only actual discomfort you will feel during the entire procedure is that initial tiny pinch of the numbing injection.
Just the pinch.
Just the pinch. Once that takes effect, we enter the second stage, which is the placement stage.
And this is where my mental image of the jackhammer comes in. What is the physical sensation of the actual drill going into the bone?
The sensation is entirely pressure and vibration. Zero sharp pain.
Really, zero.
Zero. Because of the anesthesia handling the soft tissue and the lack of internal nerve endings in the bone itself, pain is quite literally off the table.
Yeah.
However, we do need to acknowledge the psychological component here.
The sound of it? Right.
Exactly, the sound. What you will experience is something called bone conduction.
Like those headphones that sit on your cheekbones.
Very similar concept, yeah.
Right.
When the dental tools are working on your jaw, the vibration travels directly through the bone to your inner ear.
Oh, wow.
So you will hear the hum of the drill quite loudly inside your own head, and you will feel a firm pushing sensation.
Which sounds terrifying, honestly.
It can be unsettling. Our brains are hardwired to interpret that loud internal vibration as danger.
That makes perfect sense. I mean, you hear a drill vibrating inside your skull, and your fight or flight response just kicks in immediately, even if your pain receptors are totally silent.
Exactly.
It's a psychological hurdle, not a physical one.
That's a crucial distinction. If we connect this to routine experiences, the physical sensation of the placement stage is remarkably similar to the sensation of getting a standard cavity filled.
Seriously? Just a filling?
Yeah. You know work is being done, you feel someone leaning in and pressing down, but there is no acute pain.
It's fascinating that placing a permanent titanium root feels essentially identical to fixing a minor cavity.
It really is a testament to how far dentistry has come.
Okay, so what happens when we move to the third stage? Like the anesthesia wears off a few hours later. Does the body finally realize what happened and send the bill?
Not in the way you might fear, no. The third stage is the immediate aftermath. When the local anesthesia fades, you are not suddenly thrust into agony.
Okay, good.
The source material and clinical data across the board really shows that most patients experience what is described as a manageable, dull ache or mild tenderness.
Just an ache? But where is that coming from if the bone doesn't feel pain?
Good question. The ache is primarily an inflammatory response from the soft tissue.
The gums.
Exactly. The gums had to be adjusted to access the bone. So it feels very similar to the lingering soreness you get after a deep cleaning or maybe having a tooth pulled.
Got it.
It is an ache, not a piercing pain.
So if the physical reality is just a tiny pinch, some loud vibrations, and a dull ache, I mean, the gap between reality and reputation is just massive here.
It's huge.
I want to play Mythbuster for a moment because the horror stories are everywhere. You talk to people and they describe implants as if they are undergoing major life-altering surgery.
Right. The anxiety is contagious.
So let's look at the first major myth. The idea that getting an implant is significantly worse and far more painful than having a natural tooth pulled.
This is one of the most common misconceptions out there, and it is entirely backward.
Backward.
Completely. Getting an implant placed is very often easier and results in less post-operative pain, than a complex tooth extraction.
Okay, that seems super counterintuitive to me. How is drilling a piece of metal into the body easier to recover from than simply taking something away?
It all comes down to the concept of tissue trauma. We need to look at the mechanics of pulling a tooth.
All right, let's look at it.
A tooth isn't just sitting loosely in a cup waiting to be plucked out. It is anchored to the bone by a complex network of periodontal ligaments.
Like a bunch of little ropes holding it down.
Exactly like that. So to remove a damaged, deeply rooted tooth, a dentist essentially has to tear all those ligaments. You are physically wrestling a structure out of its socket.
So extraction inherently involves a lot of collateral damage.
Yes, exactly. Tearing those ligaments stretches and traumatizes the surrounding gum tissue and the bone. There is an inherent chaos to extraction, biologically speaking.
That makes sense.
Conversely, preparing the bone for an implant post is the exact opposite of chaos. It is a highly controlled, incredibly precise surgical movement.
Well, I originally used the analogy of mounting a TV bracket, which we established was flawed because of the whole live tissue thing.
Right.
But if pulling a tooth is like violently ripping a tree out of the ground by its roots, what is the right analogy for the implant?
I'd say it is much closer to a precise architectural grasp.
It's a graft.
Yeah, we aren't tearing anything out. The dentist uses specialized instruments to create a clean, exact osteotomy.
Which is what, exactly?
It's a precise hollow space in the bone, perfectly sized for the titanium post. Because there is no wrestling, no tearing of ligaments, and no collateral stretching of the tissues, the inflammatory response is dramatically lower.
Less tissue trauma translates directly to a much smoother, less painful recovery.
Exactly. The precision minimizes the body's alarm bells.
That brings us nicely to the second myth, which is all about that recovery phase. The common belief is that you will be bedridden, miserable, and forced to drink meals through a straw for a week straight.
We can completely debunk that one right now. The recovery process is remarkably straightforward for the vast majority of patients.
Really? No week in bed.
No. Because the trauma is minimized, that mild post-operative discomfort, the dull ache we discussed earlier, is easily managed with simple over-the-counter medications.
Wait, you don't need intense prescription-strength pain management for bone surgery?
For a straightforward single implant placement, no. Standard over-the-counter anti-inflammatories like ibuprofen or paracetamol are usually more than sufficient.
That is surprising.
They target the swelling in the soft tissue, which, as we established, is the actual source of the ache.
And what about the downtime? Are people taking a week off work to deal with this?
Hardly anyone needs that much time. Many patients have the procedure done in the afternoon and go right back to work the very next morning.
The next day.
The very next day. You do need to apply some basic common sense, of course.
I assume that means no eating hard candy or chewing ice the next day.
Right. Please don't do that.
Yeah.
You stick to a softer diet for a few days to avoid putting mechanical stress on the healing gum tissue.
So lots of mashed potatoes and soup.
Exactly.
Mm.
But you are absolutely not confined to your bed, and you aren't living on meal replacement shakes for weeks. Your daily routine is barely interrupted.
Wow. Okay, there is another myth that contributes to the dread, and it's about the time commitment in the chair.
The endurance test myth.
Yes. People imagine being trapped under those bright surgical lights, mouth propped open, for hours and hours of grueling work.
Well, that might have been closer to the truth decades ago, but modern dental technology has completely transformed the timeline.
How fast are we talking now?
For a single, straightforward implant, the actual surgical placement from the moment you sit down to the moment you stand up often takes less than an hour.
Wait, less than an hour, start to finish.
Sometimes significantly less.
How is that even possible?
Because dentists today use advanced 3D imaging, like cone beam CT scans. They map out the exact density of your bone and the precise angle of the implant before you even arrive at the clinic.
So they already know exactly what they're doing before you sit down.
Precisely. The team at My Gentle Dentist talks about how they often use 3D printed surgical guides based on those scans. The planning takes time behind the scenes, but the physical execution in the chair is incredibly swift and efficient.
So the agonizing, day-long mouth demolition we all fear is actually a highly precise, hour-long graft that leaves you with a mild, dull ache.
That is the biological and clinical reality, yes.
Mind blown. Okay, let's look at what happens after that initial healing phase.
The long term.
Right. We have this titanium post successfully integrated into the jaw. It's painless, it was quick, and the patient is back to normal life. I want to understand the long-term reality of this new addition.
It's a great topic.
Because I am looking at this titanium structure and thinking it has a sort of superpower.
A superpower.
Yeah. I mean, since it is entirely artificial and has absolutely zero nerves, does that mean it's an invincible bionic tooth? Is it completely immune to the things that destroy natural teeth?
This raises a very important distinction about how implants interact with human biology.
Okay.
Structurally speaking, the answer is yes. The implant itself and the porcelain crown attached to it behaves exactly like a natural tooth in terms of chewing force and appearance.
And cavities.
Because it lacks enamel, dentin, and a nerve pulp, the implant will never get a cavity. It is completely impervious to the acid produced by plaque bacteria that causes tooth decay.
That sounds like a pretty incredible upgrade, a tooth that literally can't decay and can't feel a toothache.
It is a massive upgrade in durability, yes,
Yeah.
but we have to be very careful with the word invincible.
Why is that?
This is a crucial point emphasized in the source material. The implant itself won't decay, but it does not exist in a vacuum. It relies on a living biological foundation.
Ah, the gums and the surrounding bone.
Exactly. We call it the biological seal. While the titanium is impervious, the organic tissue holding it in place is still highly vulnerable to bacterial infection.
So plaque is still the enemy.
Always. If plaque is allowed to accumulate around the base of the implant, it causes inflammation in the gums.
Just like regular gingivitis.
Yes. But with an implant, if that inflammation travels down beneath the gum line, it attacks the bone that the titanium is fused to.
Oh, that sounds bad.
It is. We call this condition peri-implantitis. The bone begins to degrade, and if left untreated, the entire implant can loosen and completely fail.
It's almost like building an indestructible titanium house, but neglecting the property so badly that a sinkhole swallows the foundation.
That is a perfect analogy.
The house is perfectly fine, but it still collapses because the ground gave way.
That is exactly how you should visualize it. The bionic tooth requires a healthy organic neighborhood to function. This is why the checkup and clean rule is absolute law for implant patients.
So the daily maintenance isn't actually for the new tooth, it's for the tissue surrounding it.
Exactly. You still have to brush twice a day. You absolutely must floss or use water flossers to clean around the implant base. And booking your standard checkups and cleanings with your dentist is totally non-negotiable.
It's a team effort between the tech and your biology.
Right. That routine organic maintenance is the only way to protect the bone and keep your new implant strong for the rest of your life.
Well, this has completely changed how I view this entire procedure.
I'm glad to hear that.
We started with this terrifying, visceral image of drills and heavy construction and stripped it down to the actual mechanisms of the human body. Let's synthesize the key takeaways for the listener right now.
I think the most important realization is that your fear is mostly based on a biological misunderstanding.
Right.
Because the internal structure of your jawbone lacks the dense nociceptors of a natural tooth. The sharp, agonizing pain you anticipate is physiologically impossible.
And we also learned that the sensory experience in the chair is highly manageable.
Very much so.
It's just a tiny pinch for the numbing, followed by loud vibrations and pressure during the brief placement. It's really an exercise in managing psychological anxiety over the sound, rather than enduring actual physical pain.
Absolutely. And we clarified the recovery, too.
The tissue trauma myth.
Right. Because the procedure is a precise, planned graft, rather than the violent tearing associated with tooth extraction, the tissue trauma is minimal. You are looking at a dull ache managed by over-the-counter anti-inflammatories, not a week confined to bed eating soup.
Though soup is good, but the overarching lesson here is that fear of an imagined pain should never stand between you and your quality of life.
Exactly.
An implant is a highly controlled, incredibly safe procedure that ultimately restores your ability to chew naturally, speak clearly, and just smile without hesitation.
And once it's healed, as long as you maintain that organic foundation with basic brushing and dental visits, it functions seamlessly with the rest of your body.
It really is a remarkable synthesis of technology and biology.
It's modern medicine at its best.
For anyone listening who has been putting off restoring a missing tooth because the idea of the procedure paralyzed them, this is the moment to reevaluate.
Strongly agree.
The team at my Gentle Dentist in Arana Hills provided the insights we use today, and their entire approach is built around this exact science, minimizing trauma and maximizing comfort.
Reaching out for a consultation is a logical step toward reclaiming your health, especially armed with the knowledge that the myths simply don't hold up to the science.
Taking that step is really about refusing to let an illusion dictate your healthcare.
Which actually leaves me pondering a broader question based on the anatomy we've discussed today.
Oh, what's a thought?
Well, we've established today that human anatomy is structured in such a specific way that surgically embedding titanium into our deep jawbone causes significantly less pain than dealing with a microscopic cavity in a single natural tooth.
Which is still so crazy to think about.
Right, but our brains completely fail to predict that reality. We assume the worst based on flawed associations.
We confidently predicted agony where there were literally no pain receptors to feel it.
Exactly. So it begs the question,
Hmm.
what other hidden physiological or psychological blind spots do we possess?
Oh, wow.
If we can be this dramatically wrong about our own physical capacity for pain in the dental chair, how many other areas of our lives are governed by an overactive imagination?
Does our brain's tendency to predict the worst-case scenario actually cause us more suffering and hesitation than reality ever would?
That's the question.
Are we constantly manufacturing our own dread based on bad data? That is going to keep me thinking for a long time.
It's a lot to chew on.
We sat down to talk about titanium roots and ended up questioning the reliability of human anxiety itself.
The physical and the mental are always intertwined. Understanding the science is the best way to quiet the mind.
It certainly is. Well, thank you for dissecting the biology and the reality with us today.
My pleasure.
And thank you for joining us on this deep dive. Until next time, keep questioning your assumptions, take care of your biological foundations, and we will catch you on the next one.